Esketamine is a NMDA receptor antagonist used for treatment-resistant depression. In this video, let's found. What is esketamine? What is esketamine used for? Contraindication. What are the side effects of taking esketamine? How does esketamine work? How to use esketamine? What is esketamine? Esketamine, also known as ketamine or esketamine, is the S-enantiomer of ketamine, is a dissociative hallucinogen drug used as a general anesthetic and as an antidepressant for treatment of depression. It is sold under the brand name Spravato, Ketanest, among others. In the form of racemic ketamine, esketamine was first synthesized in 1962 and introduced for medical use as an anesthetic in 1970. It is used as an anesthetic in the European Union and as an antidepressant in the United States and Canada. What is esketamine used for? Esketamine is indicated in combination with an oral antidepressant for the treatment of treatment-resistant depression in adults. It is also indicated for the treatment of depressive symptoms in adults with major depressive disorder experiencing acute suicidal ideation or behavior. Contraindication. Esketamine is contraindicated in patients with a known hypersensitivity to esketamine, ketamine, or any component or excipient of the formulation, and in patients for whom an increase in BP would be hazardous. Side effects. The most common adverse effects of esketamine for depression, greater than or equal to 5% incidence, include dissociation, dizziness, sedation, nausea, vomiting, vertigo, numbness, anxiety, lethargy, increased blood pressure, and feelings of drunkenness. Long-term use of esketamine has been associated with bladder disease. Pharmacodynamic. Esketamine is considered a central nervous system (CNS) depressant agent. It may cause sedation, dizziness, and lethargy, among other symptoms. This drug has dissociative and antidepressant properties. Acutely, esketamine may impair attention, judgment, thinking, reaction speed, and motor skills. Esketamine causes increases in systolic and/or diastolic blood pressure at all therapeutic doses. Peak blood pressure elevation after esketamine administration occurs about 40 minutes after administration and lasts approximately 4 hours. Mechanism of action. Esketamine, the S-enantiomer of racemic ketamine, is a non-selective, non-competitive antagonist of the N-methyl-D-aspartate (NMDA) receptor, an ionotropic glutamate receptor. The exact mechanism by which esketamine acts as an antidepressant is unknown. The primary circulating metabolite of esketamine, noresketamine, shows activity at the same receptor with a weaker affinity. Half-life. The mean terminal half-life, T1/2, ranges from 7 to 12 hours. Dose. Treatment-resistant depression. Indicated in conjunction with an oral antidepressant for treatment-resistant depression, TRD. Adjust dose based on efficacy and tolerability. At the end of the induction phase, evaluate evidence of therapeutic benefit to determine need for continued. Must be administered in healthcare facility under direct supervision. Induction phase. Weeks 1 to 4. Administer intranasally twice per week. Day 1 starting dose, 56 mg, subsequent doses, 56 mg or 84 mg maintenance phase. Weeks 5 to 8. Administer intranasally once weekly, 56 mg or 84 mg week 9 and after. Administer intranasally Q2 week or once weekly, individualized dosing frequency to the least frequent dosing to maintain remission/response. 56 mg or 84 mg, major depressive disorder. Indicated for depressive symptoms in adults with major depressive disorder, MDD, with acute suicidal ideation or behavior. Administer intranasally in conjunction with an oral antidepressant. Must be administered in healthcare facility under direct supervision. 84 mg twice per week x 4 weeks. May reduce dose to 56 mg twice per week based on tolerability. After 4 weeks of treatment, evaluate evidence of therapeutic benefit, determine need for continued treatment. Use in conjunction with an oral antidepressant beyond 4 weeks has not been systematically evaluated for treatment of depressive symptoms in patients with MDD with acute suicidal ideation or behavior. Safety advice. US FDA pregnancy category, not assigned. Risk summary. No data are available on the use of this drug in pregnant women. That's all the information about esketamine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.